Assalamu alaikum. The communication day, the first scenario, Mrs. Jones, a 35 years old lady, admitted with a history of productive cough and fever and weight loss. For the past few months, she is married and has a 80 years old son, and her husband is a lorry driver. Chest X-ray showed evidence of hilar lymphadenopathy. Sputum was positive for TB bacilli, tuberculosis bacilli, and she was also consented for an HIV test, which came positive. Please explain to Mrs. Jones her diagnosis management option and contact tracing.
Okay.
Yes, you can start, Dr. Yasser.
Thank you,
Okay.
doctor. Are you ready, doctor?
Yes, yes.
Okay. Good evening. I'm Dr. Yasir. Can I
Good.
confirm your name and age, please?
Yes, I am Mrs. John.
Okay, Mrs. Jones. Today I'm here to talk about your medical condition. And do you want me to involve anyone in our conversation?
No, doctor, thank you.
Thank you. So to be on the same page and to be in a position where I can answer your questions more precisely, can you tell me how much do you know about your medical condition?
Well, doctor, yeah, I have a very bad cough and high temperature for really now 2 to 3 months, I think. I am
Mhm,
concerned also that I lost a lot of weight through these months as well. I came
mhm,
here and they making to me some image.
mhm,
It is true for me because they said that I have something concerning in my lung, and after that they asked me for some sample from my
mhm,
phlegm.
mhm.
They also test me another blood test, and I am very worried, really, doctor, about that.
Okay. Mrs. Jones, good to know that you know lots of things about your health condition and you are really concerned about your condition. Good to really appreciate that. And you rightly said so that you know you had the fever, weight loss, okay, and it was going
Yeah.
with you for a long time. I'm really sorry for that. And for that, you rightly said so. We had gone for some of the blood test, X-ray, or the imaging of your chest and or the blood sample for the sputum sample for the another tuberculosis test and also the HIV test from your blood. And the reports are in front of me, but I'm sorry to tell you, Mrs. Jones, that I didn't have really good news to share with you.
Oh my God. Really, it is a cancer?
Uh, 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 Miss Jones, rather than a cancer, you know, your imaging or the X-ray shows, you know, there is enlargement of the some of the tissues in your some of the tissues in your lungs and another on a very not the pleasant news is and we did the sputum test which is showing the tuberculosis, Mrs. Jones. uh, have you
Oh my God.
okay, okay, have you heard about it this condition before?
Yes, yes, doctor. Yes, I know it. It is horrible. I know that it's not a cancer, but I know this is a condition that
Mm-hmm.
I think I can infect my family. I can making him also sick. I have a
Mm-hmm.
young child. I'm very
Mm-hmm.
worried now about him. It is nonsense that I have this condition.
Mhm. I can see the things is really difficult for you to digest, and it's not the pleasant scenario to be in. But I am really sorry to tell you that this is what has happened with you, Mrs. Jones. And unfortunately, I have uh, another test report of the blood samples also, and the report is also in front of me. And for that also, I am really sorry. I don't have very good news to share with you, Mrs. Jones.
So, doctor, please tell me first how I get this. uh, tuberculosis. I'm worried about that. From where I can take this bug?
Okay. Mrs. Jones, so we at this time we are not sure from where you can you got this the disease, but to know the exact things, we need to we need to uh, we need to contact with our this infection control team. Okay, they will do the test for other family members of yours, and after that maybe we'll be in the better position to answer your queries, Mrs. Jones. Is it all right?
Yes, doctor. Yes, it's
Mhm,
okay.
mhm.
And so what is the result of other blood tests, doctor? What is
Okay.
the problem? Other problems that you talk about?
Okay, for that also, I don't have very good news to share with you, Mrs. Jones. In fact, the blood sample which we had taken for the HIV test, it came out to be positive, Mrs. Jones.
Oh, it's horrible, doctor. So, what I'll do now?
Yeah, I'm really sorry to say divulge all these bad information to you, but at this time, it is very important for us not to lose our calm and be patient and try to act rationally rather than thinking otherwise, because both of these tuberculosis is treatable, and for the HIV also there are medicines that are available, what we call the antiretroviral therapy. So we need to inform the infection doctor, and then they will start you on medicine for this, Mrs. Jones. Are you understanding?
Yes, yes, doctor. But really, it is a lot for me now.
Mhm, mhm,
I really
mhm,
need
mhm.
to absorb all that.
Yeah, yeah.
So, doctor, about uh, what I don't know now. What you can
Mhm,
do for me?
mhm, mhm. Yeah, I really appreciate your concern. So first thing first, we need to inform the infection control team and the doctor. They will start the medications for you. This is the number one thing, and number
So
two
it is
is.
like a tablet, doctor, also. So I can take at home and I can manage myself by it.
Yeah, actually, they will assess your conditions first, whether you are, how is your conditions of your house, whether you have the favorable condition to take the medicines regularly or not. They will assess all the conditions and accordingly, and they will take you in confidence, and whatever is suitable for you, they will do accordingly, Mrs. Jones. Don't worry about that. Are you
Mhm.
following me? Following
Yes,
me?
yes, yes, doctor. But really, I need to be at
Mhm,
home so I can care of my child. I have one child, and no one can take
mhm,
care of
mhm.
him.
Yeah.
And
Yeah.
about the HIV also, doctor, that
Mhm,
I'll start also medication. So it is not
mhm,
a lot about to me. So I'll take all this medication.
Two
mhm.
minutes.
Yes, yes, Mr. Jones. Yeah, it is very important to take the medicines, and on top of that, you have some. You need to take care of yourself, and also you need to inform your husband about your HIV status. And for the time being, you need to take some precautions. Also, you need to avoid the unprotected sex, and you need to avoid sharing the needles. You need to avoid. The blood transfusion to the others. Okay, so these are very important steps that you
Hmm.
need to take, Mrs. Jones.
Okay, I understand, doctor, but it is very
Mhm,
hard to me to tell my husband like this
mhm.
news.
Mhm. Yeah, I really I can understand the how difficult it is for you. But having said that, it is very important for you to tell this news, to your husband, because if you don't tell, you even put him at risk, at risk, and it is your responsibility, in fact, to inform him, Mrs. Jones.
Mhm.
Is it all right?
Well, doctor, and you were making like test for my son also.
I actually, this infection control doctor will assess your conditions, and yeah, he, according to the protocol, he might check your son's HIV also. Yes, Mrs. Jones, you're right.
Mm. So,
And
do you know, doctor, what time I can be infected by these bugs and HIV, especially from where and what time I get it?
yeah, it is difficult to say now. We need to, again, the infection control doctor will give you the ask you the detailed history. They will analyze it, and later on they can tell you more about what are the possible sources, Mrs. Jones.
Mhm. Okay,
Okay,
okay.
but so we can agree on one point. You are you informing it to your husband, right?
Really, doctor, I'll think about that.
Okay, okay,
Okay.
good to know that you think about.
Yeah, time is up. Thank you, Dr. Yasser. Well done.
Mhm.
No,
We can hear.
you don't do anything.
Well
No, it's
done,
okay.
Dr. Yasser.
You did great, really. Dr. Aisha will comment first, please.
Okay, well done, Dr. Yasser. You inform the information with a very emphatic way, and your way good in informing the bad news. Just at the start, you can ask about expectations, so it will guide you directly to deliver the news. About the
Mhm.
information I told you at the start, no need to repeat it because this scenario is already long and a lot of things you should
Yeah, yeah.
mention. So you don't you no necessary, and it is better not to inform the information again that I told you. And one someone commented that he found this comment in his feedback that they comment why you repeat the information. You didn't give an active listener to the patient, so you repeat
Mhm.
another information he already
Mhm.
uh, told
Mentioned.
you about. So it is better for you and also
Mhm.
for the feedback for you to save your time because you have limited time to deliver too
Mhm.
bad news and to manage the concerns of the patient
Mhm.
about that. So at first about TB, you deliver it first. So you should admit the patient if she has active TB. Okay,
Mhm.
so you should tell
Mhm.
her that you will we will admit her, and maybe she will conflict about this, but you will tell her that your health and the health of others is our priority because you are caring or more concerning about your son or your child, but already if you go home, you will make him prone to this bad bug, and for safety of you and others, we should keep you here for some days. She can ask you for how long, or we can tell her. You can tell her that we should start right now the
Mhm.
medication and you can, after telling her tuberculosis, you can give her TB for short. If she know or don't know, she can. You can manage by this term the conversation. So about TB, we will start the medication right now, and she will tell you
Mhm.
for how long. At least we don't know right now for how long we will keep you in hospital, but it's at
Mhm.
least 2 weeks to 1 month till we make sure that you are not infected to the others. Then
Mhm.
the medication you can take at home. And about
Mhm.
HIV, we can postpone starting the medication for your safety because this TB can
Mhm.
be more worsened if we started all this medication together. So we'll start
Mhm.
it as soon as possible if your condition allowed us to start the other medication for HIV. About concerning from where I catch this problem, you perfect answer it. We don't know. Just the other thing is that you missed the social part that support and
Couldn't
yes,
reach up to their doctor.
yeah, how is support and smoking and alcohol,
Yeah.
and the management plan that we will support you, like giving social support, and also if you feel an anxiety or something, we have special team for that. They will support you at the time, bad days. Other thing also, here you should mention about safe sex, as you said. This is a very important point, and it is very good. Also, you about informing the family. You can encourage, if she said it is difficult. You'll said, I'll arrange another meeting if you are willing. And you can invite it in this meeting, so we can tell your husband by good words if you can't tell him. And we have a special way about that, so don't worry about that. Um, at first, you invite someone at any sensitive delivering news like this, HIV like this. You can't invite anyone to attend, because it is like
Yeah, yeah.
sensitive delivery of news. So
Yes,
it is not good here to invite someone.
yeah, yes.
Um, I
I
think
missed that
this
one.
is all. I think this is all what I have in comments. And Dr. Bassem, if he has other
Actually,
comment.
everything went wrong, doctor.
It is
Yes.
very common scenario now in this diet. So I know
This
we did it
this was
many
asked,
times,
doctor.
but it's very important because it is repeating a lot in this diet.
Yeah,
Well done. Thank you, Dr. Aisha. Well done, Dr. Yasser, by the way.
not well
You
done,
were...
doctor.
No, no, you are... Why you lost the confidence?
No, no, because I didn't know, doctor. Lots of things. First point itself,
Anyone
I.
taking exam once, he lost. But
Yeah,
you're really
exactly.
well done, Dr. Yash.
Oh,
Doctor, yeah,
I will
can
repeat
tell.
the same
Yeah.
advice, by the way. Dr. Aisha already commented, but for
Mm-hmm.
the importance of the point, I should repeat it. In
Yeah.
HIV or any sexual transmitted disease, don't invite anyone,
Yes.
particularly this infectious disease, the sexual
Yeah.
transmitted or any infectious disease. The
Okay.
second thing, yeah, the expectation, better to ask them earlier, and
Mm-hmm.
don't repeat the information as already informed by here, and it's
Mm-hmm.
already written in the paper.
Okay.
So there is two means. You didn't read the scenario if you mention them. I mean, if you repeat the signs she has, like you are not reading the scenario well, and they will comment
Mm-hmm.
on that. So the best way, you will tell her the symptoms that you have. Okay. Then
Mm-hmm.
the next point, when she asks you, don't inform my husband, you can ask her why.
Mm-hmm.
If she has any concern, you can address. For example, if she told you, I'm worried he will leave me, you can reassure her that no, he is the person who supports you, he loves you, and you need his support as well. He should know.
Mm-hmm.
If she didn't, yeah, encourage her to inform him, but you have to know why she doesn't want to inform him.
That is important. Yeah.
Yeah,
Why? Yeah.
exactly. Then I think, yeah, from where I got this bug, there is a hidden agenda in some scenarios that she's nurse, she is doing some tattoo
Mm-hmm.
maker. So the best way is to ask her job, either soon or
Mm-hmm.
later. If you know the job, you might know the risk of carrying or having this infection. Okay.
Mm-hmm.
So
Uh,
please,
uh, it is not the like. How about the infection control doctor will take you the detailed history. You'll do more workup in it, and
yeah,
he.
it's okay to say that, but if
Mm-hmm.
she's insisting to know from where,
Mm-hmm.
you can tell. You can tell.
Okay.
You get maybe from your job, maybe.
Mm-hmm.
So if you know the job, and the job, by the way, one of the social support questions.
Yeah. Yeah. Mm. Yes. Yes, doctor. Yeah.
So you can ask, and if you know that's the job, you might know the risk from where she got.
Yeah. Yes, doctor. Yeah. Yeah.
Okay, and I think so. Yeah, support also, as Dr. Aisha mentioned, you have to give
Yeah.
and provide support from the start till the end. A leaflet
Yes.
brochure about the side effects,
Mhm.
and the possible, if you have time, of course, the
Mhm.
medication and the protocol.
But doctor, is it contraindicated to start the anti-tubercular and ART together?
Okay, what do you think? If you don't know this information, how you can answer it?
Yeah, the infection control doctor, we can answer your questions more precisely.
Exactly.
Yeah,
No one will know exactly what and
yeah,
how, what he will start.
yeah. We don't know.
Yeah,
That
anyone.
is the,
I don't think only that infectious control or infectious disease team, they know
yeah,
what and how to start. So the best
yeah.
way to avoid this, there is a protocol or there is guidelines for such disease.
Mm-hmm.
Uh, so you can just say they will address that, and we can have another meeting with them to give you
Mm-hmm.
all this information.
Yeah.
Okay.
Okay. Okay. Okay.
But they
Yeah.
started at anti-tuberculosis first. You should know also this information. This,
But together, I think we can start, doctor.
no, they
No.
didn't start together. Yes, if
Oh.
active, we should start anti-tuberculosis first to settle him, then HIV medication. If started together, they causing flaring of TB. So you should starting treating TB first. It is like
Mm-hmm.
also the biological treatment at same issues. Yeah.
Mm-hmm. Good. But I used to manage those cases in Nepal. We used to start. Okay, maybe the guideline, maybe I don't know. Okay. Anyway, good doctor. No problem. Thank you, doctor.
Okay, welcome, Doctor. Yes.
Uh,
So,
So you have
three things
scenario
I
for me or
mistakes I did. Okay, one is that one I shouldn't have someone to involve someone. That is the grave that makes you fail. Okay, doctor. So for your case,
yeah, sorry,
okay.
I receive a call. Sorry. Can you please send the scenario for her, for Dr. Aisha?
okay, can I read, doctor?
Yeah, sure.
Okay, 25-year Mr. John, patient diagnosed HIV with he has the history of the IV drug user
Mhm,
and quit. Now patient doesn't want to take the medications and is still drinking alcohol.
mhm.
Okay, so your task is to
Sounds
yeah,
mm,
counsel. Yes,
okay. Okay, give me 1 minute and
I lost the thoughts, everything. Huh? Need to practice.
The scenario for HCV, right? Discovered
Yeah,
to
yeah,
have HCV.
yes,
Okay.
sorry, HCV, not HIV.
yes, CV
H
doctor.
Yeah,
HCV.
his
Okay.
drug abuse already quit, and now
Mm-hmm.
while doing follow up, they discover HCV positive,
Mm-hmm.
and he's alcoholic and smoker, right?
Yes, doctor.
Yes, perfect. Okay, you ready or I will give you 2 minutes. I
Okay.
will read this comment, Dr. Abu Jido. Admission, isolation, notification, retracing. Yes, of course, you should do all these steps. The admission, is a must, particularly if this patient is having open TB or
Mm-hmm.
AFP positive. It's not mentioned in this scenario, but you
He
can
had
add.
fever and the productive cough and
Okay, yeah. So from the
it's
symptoms,
active,
you mean?
yes.
Yeah, from
Yeah.
the symptoms. Okay. So it
دكتور
should be
باسل
admitted for two
تمام.
weeks. Sorry?
كيف حالك؟ تمام دكتور علي. علي أحمد.
Yes, hello, Dr. Ali. Yes.
الله يسلمك. For any communicable disease like this يعني tuberculosis meningitis we need this for more يعني for more important steps. We need to be admit the patient, we need to isolate the patient, we need to notification to inform the infectious control, and even we need to contact tracing. Uh, as Dr. Asha she said, this patient usually we need to start anti-TB first. Then after 2 to 3 weeks or even 1 month, we will assess him for anti-retroviral. This is my comment just.
Okay, thank
Yeah,
you, Dr. Ali. Okay, I have a question now about the information of starting anti-TB before starting the heart. So what's the idea behind that? So is it related to the immunity and maybe the flare of the HIV or the opposite? Anyone knows?
I think because I think that because tuberculosis is very active and usually
Yeah.
ongoing inflammation, and ongoing inflammation, we need to settle this infection. Then you can control the HIV. Sometimes even HIV, when you're doing blood investigation like CD4 and like CB, complete blood count, you will find the patient is stable and the patient may be asymptomatic. But we need to control the infection first because this infection now is ongoing. And if you not control the infection, this patient maybe will prone to more complication. I don't know. This is my answer.
Okay, thank you, Dr. Ali.
Something related to immunity, but I don't know the exact mechanism.
Yeah. Yeah. Walaikum salam wa rahmatullahi wa
normally,
barakatuh.
doctor, if you'll give the heart, CD4 count will increase. So, it
Yeah,
then,
supposed to improve, not to, yeah.
yes, supposed to improve. That is the basic logic, but I don't know, doctor.
I think there's something, if we started the anti-TB with the HIV, there's some, I don't know what exactly the mechanism, but it's the called reconstructed inflammatory syndrome.
Uh-huh.
I think there's something related to the immunity. For that, you needed to start the anti-TB before HIV treatment.
Mm-hmm. Could be, doctor. Yeah, because that is also possible. If CD4 count is high, then you will not start that flare up. That I mean, if
Yes,
CD4
flare
count is
up.
very low
Flare
means.
up.
Mhm.
Yes, flare up. I think HIV and also TB. For that, needed to start an anti-TB to
Mhm.
prevent the worsening the symptom of the anti-TB.
Mhm. We can check. Okay, tomorrow I'll check. Anyway,
Okay, thank
I
you, Dr.
think
Rasha. Thank
whatever.
you.
Yeah, the way she is, I think she's right. I had somewhere hard.
Yeah, I think if we can ask any infectious disease
Doctor?
registrar or specialist, he
Yeah.
can give us clear information about that. Is it related to the CD4 count? Is it related to flare up?
Yeah.
But thank you everyone for the comment and for the effort.
Sorry,
Freddy, Dr.
please,
Aish. Yes,
please,
yes,
Dr.
sure.
Bassam.
Yeah, yeah.
As Dr. Ali said, after 1 month, we will assess to start heart medication.
Mm-hmm.
Why don't wait 6 months after finishing IRIB, Sambutor, rifampicin,
I don't know,
يعني
really.
the full treatment of TB.
The problem here, why we will not start the HIV right now, because if you discover that the patient has HIV, you should start, not delay. So why
Yeah.
you will not start? Because this problem in immunity, something happen in the immunity if you start the treatment HIV without treat the TB, it causing a flare of the TB and worsening of symptoms. So at this time, they starting TB, they settled it. It maybe take 2 weeks, 3 weeks, then they start the HIV treatment, because HIV you can't delay also the treatment,
Yes.
because it is also serious infection.
Mhm. Mhm.
So
And
the problem here,
also,
why you not to start the HIV, and this is the
Yeah.
usual equation,
yeah,
but
yeah.
we will not delay till end of treatment of TB.
Yes. And another thing is, even the CD4 count will go up if you start the ARTs. So CD4 count will go up. So in fact,
Yes, but it is something related to immunity, something flaring the
should be,
TB
doctor.
if you start.
Yes,
But
yes.
I don't know the exact mechanism, but it is something
think
as they write, it is called the immune reconstitutional syndrome, and I don't know exactly the mechanism, but it is known, and they making this many times about this scenario This I heard it from more than one.
Yes, I think
Yeah,
if it
Doctor.
started
Yeah, Doctor.
HIV, the same with the anti-TB, flare up the worst the symptom of the TB symptom. For that, you needed to start the anti-TB 2 weeks before started the HIV to prevent the flare up and worse the symptom of TB.
Okay.
I found the answer, Dr. Basim.
Okay.
I found the answer. One of the answer because tuberculosis is a more immediately life-threatening condition and rapidly progress and lead to severe complication or death if not treated quickly, especially in immunocompromised patients like HIV. Number two, to reduce TB-related inflammation before start an antiretroviral. Uh, because if you starting antiretroviral too early can trigger what we call immune reconstruction inflammatory syndrome. Okay.
Perfect. Yes. Same. Yes.
Yeah. Number three, to assess drug tolerability and side effect. Tuberculosis drug have significant side effect and starting them before antiretroviral
صباح قال لي
allow clinician to monitor for toxicity or allergic reaction. Number four, drug interaction management.
قال
Anti-TB and
لي 7:30
antiretroviral
10.
interact.
Yes.
Starting tuberculosis treatment varies help plan and adjust an antiretroviral regime based on the TB drug being used. Antiretroviral is usually start within 2 weeks or within 8 weeks after anti-tuberculosis treatment initiation based on WHO guidelines.
Mhm. Thank you, Dr. Ali.
Okay,
So,
thank
so
you,
the,
Dr.
the,
Ali.
the, the same duration of overlap with biological therapy with the rheumatoid.
The
The
same,
same,
yes.
yeah, the same point. Yes. Thank you, Dr. Ali, for your effort. Let's start the second
تمام.
scenario. Yeah,
Okay,
Dr. Ali, ready? Yeah, here you go.
yes. Okay,
السلام عليكم. معلش بس نقطة صغيرة
okay.
في الحتة بتاعت الليجل ايشو
Sorry, yes?
معلش صوتي واضح؟
Yes, yes.
اوكي. في الحتة بتاعت الليجل ايشو تريسنج يعني انت
Yes.
if the
Yeah,
if
yeah.
this
What the question quickly?
if this patient insists not to inform her wife or not to inform her partner whatever
legal issue.
في واحد من الحالات بيقول انه inform them even they don't want.
But not like that. You will tell like that. We will arrange
Yeah.
another meeting or we can help you. And you can offer that is we will nominate and send the letters for the contact without mention that you are the one having this condition. They said now this is not, you can't breach the confidentiality even in HIV or, but the TB you should isolate so they will know. But for
Yeah.
HIV, the new guidelines that you will encourage, but you should not
Yes.
breach the confidentiality. You can send
Yes.
anonymous letter to the contact
Exactly.
to trace. Yes.
Yes.
اليو not yes not to break confidential. لكن في الانكورجمنت ذاته انت inform the
Yes, you will make effort in this point, not to leave it from start. You will encourage and let her
and there
offer
is some
meeting. Yes. Mm.
and there is some maybe you will be some facing problems and that is maybe some legal issue if you don't inform them and I highly recommend it and highly advise you to just to inform
Yes. Yeah.
your partner, your husband, whatever.
Yes.
Right. Yes.
Okay. Thank you. Let's start the scenario, Dr. Aisha. Ready?
Okay. Yes.
Here you go.
Okay. Hello. I am Dr. Mitwali, the doctor in clinic today. May I confirm you are Mr. June?
Yes, doctor.
Okay. Can I confirm your age, please?
I'm 25 years old, doctor.
Okay. Okay. Welcome, Mr. June. We are here today to discuss your health condition. Is this okay with you?
Yes, doctor.
Okay, so to be in the same page, Mr. June, can you tell me to what point you know about your health condition?
See, doctor, I know I'm sorry to tell you that I'm an IV drug user, and I came to the hospital for my routine checkup, and but
Mhm.
my doctor diagnosed me. I have the condition called the hepatitis C virus infection, and
Mhm.
the doctor, is I'm a drunk. I'm continuously drinking also, and my doctor wants me to start on the medications, so which I don't like, doctor. That's why I'm here. There are any other methods to avoid these medications, doctor? I want
Mm.
to talk about this, doctor.
Okay, I really appreciate Mr. John how this is difficult times you are on, and I'll reply yes all this point and all your concerns during our conversation. But let me know first why you don't like to start this medication.
Because doctor, I might need to take it for a long time, and taking medications daily is not my cup of tea, doctor.
Mhm. Mhm. I know that this maybe at first time for you to be difficult, but really I need to tell you about this bugs that you catch in your liver that is called HCV virus. Do you know about it, or can I tell you some information about?
No, doctor, I don't know.
Mhm. Okay, so
And
about this bug, I am regretfully said that it is a serious bug infect the liver, and it is very serious if not treated at time. It can harm
mhm,
your liver badly by time, and if your liver harmed, it can affect other organ in your body. And also we document and this virus causing cancer to the liver. I'm sorry to tell you that at some point.
mhm. And
So, mhm,
another important concern for me is, doctor, I feel I'm afraid because I'm drinking continuously, and if I'll take the medicines with the drinking, it might harm me more. That is another concern for me, why I don't want to start the
mhm.
medicine, doctor.
Yes, I appreciate that. I see. So about drinking, Mr. John, so we really advise at this time to stop this drinking. But I need to know more information about your drinking. As you said, I drink so much. So can you tell me how many units you drink per week?
Maybe more than 20 units, doctor.
It is more than the advised units. And do you have any binge drinking?
Yes, doctor.
Mhm. Can I ask you some other question? If you woke up searching for alcohol, or this is the first thing you have when you wake up at morning, the alcohol?
Yes, doctor. You are right, doctor.
Mhm. And if you feel blamed about drinking a lot,
Yes, doctor.
you feel that the people may see you in bad way about drinking.
Yes, doctor.
Mhm. Did you try before to stop or quit this alcohol?
Yes, doctor. But if I'll stop taking alcohol, I can't function, doctor.
Mhm. Yes, I think, Mr. John, you need advice from the alcohol advice unit here. So we will include that in your management. Will help you very good, and they have ways to stop the alcohol with some
Mhm,
medication. And we need to
mhm,
keep you at hospital at first days, and they
mhm,
having a good result with others really. And
mhm,
we really very recommend it for you because the alcohol may worsen your condition more and harm your
mhm,
liver, and it
mhm,
all shortens the life. I'm sorry to tell you that.
mhm. If you can do that, I'll really appreciate you, doctor. That
Yes,
I
sure. Yeah.
really- because that
Mhm.
is the main reason why I don't want to start the medication, doctor.
I can
So
see. Okay. Okay. This is very good point from you that you are encouraged about this point, and we will make
mhm,
it in your plan at first, so
mhm,
you can make easy to you to stop and to quit the alcohol. We will keep follow up after that also to make sure that you are not coming back to it. About the medication of virus, we really have a good medication. Yes, it can have a bad effect and you should take daily, but really it is its benefit, it is more than the harm you can face, and you may not face any harm of that with good follow-up and good compliance of this medication. So I really advise you to start this medication with good follow-up with a clinic, so we can make sure that it will not harm you at all. And if you have any problem with it, we can solve that. Are you
Okay, doctor.
willing
Okay.
now to start this
Yes,
medication? Okay.
yes, doctor. Yes, it has lots of the benefits, and you are even willing to take me to this alcohol cessation center. So that is also appreciable. And if it really helps me, it is fine, doctor. I'll oblige with you and I'll start the medication, doctor.
Mhm. It's
Thank
really
you, doctor.
appreciated, Mr.
Mhm.
John. So can I ask you that about the drug? You said that you are quit this drug that you took in the past, or?
Yes, doctor.
Mhm.
And fortunately, I have been able to quit it, doctor. Yes.
Okay, this is
Mhm.
I appreciate your effort, Mr. John, and about care about your health. So can I ask you that what you do for living now, Mr. John?
Yeah, I'm still searching for the job, doctor.
Mm-hmm. Yes. So you
And
need any support
unemployed
right
actually.
now? Okay, okay.
Yeah,
And any
yeah,
financial support, are you dependent on anyone?
yeah, doctor. If you can provide it, it will be really helpful for me, doctor.
Mm-hmm. And with whom you live, Mr. John?
Actually, I used to stay with my family, but now I'm uh, mostly staying alone, doctor, because
Mm-hmm.
they have very problem to stay with my other family members. So that's
Mm-hmm.
the reason why I'm alone nowadays.
I see. So I'll include also in our management the social health. So they will speak about this point and try to help you as much as they can, Mr. John. And I'll follow up
2
this
minutes
by
left.
myself.
Mhm.
I follow up this with myself, so we can make sure that you are supported and you are
Mhm.
really have a good life in the next days. So also, I advise if you have near friends or one can support you in these days, so it will be better. So
Mhm.
they can help you and provide you support.
Yeah,
Um,
I'll try on
okay.
that front, doctor. But if you can provide me the social support, that will be really appreciable, doctor.
Yes, we will try that all at this. We will include this in your plan also. And do you smoke?
No, doctor.
Okay. So I provide you, Mr. John, with some leaflets about your condition and about
Mhm.
how you will take this medication, and we will start your management by the alcohol advice. So
Mhm.
they will provide you how you will quit the alcohol and what medications you will be on, and they will support as much as they can. They will admit you for some days.
Mhm.
Also, I'll give you the contact number of our department, so you can contact at any time to ask any questions we didn't answer here at this meeting. And if you need any help, don't hesitate to contact us at any time.
Okay, doctor. Thank you, doctor. I'll
Okay,
do that.
thank you.
Okay.
You're done, Dr. Aisha, right?
Thank
So
you.
let's hear
Yeah.
Yes, I
Dr.
think.
Yasser comment.
Yeah. Good, doctor. I think you did great job. You identified the condition well and management plan also proper. You have been able to solve the concerns and they've been able to convince the patient to start on the medication. I think overall you did great. I think,
You are
doctor.
kind candidate. You are kind surrogate. Thank you.
No problem.
Dr. Yasser, this is your scenario in the exam?
No, doctor. No.
Not yours, right?
This is the past question, doctor. That collections of the this what is that diet one collection, doctor.
Yeah, this unfortunately this scenario was mine.
Your
Yeah, it was
okay,
mine. Yeah. Let me tell you about the comment because it
okay,
was
doctor.
surprising comment. It
Okay.
was a comment from elderly lady.
Mm-hmm.
This elderly females with the short haircut.
Mm-hmm.
She's like grandma, yeah, very old. Anyway,
Okay.
imagine what she wrote about. I talk a lot about alcohol.
Mm-hmm.
It was against her wish that I spoke about alcohol, and so she wrote in her comment that I lectured about alcohol. So,
Really?
yeah, really, she wrote like that,
Uh-huh.
and she minus me, of course, in the clinical judgment. She wrote
Oh.
that I lectured in the alcohol.
Is alcoholic
Uh-huh.
like that?
Yes, of course,
Uh,
she's.
so
I
what you will
guess
do? You will tell
I don't
him
know. I
continue?
don't know. I don't know if the patient is already HCV recently
Uh-huh.
and he's alcoholic with such amount. Even I didn't ask about amount because I'm talking about cut down.
Uh-huh.
I thought they will write in the negative feedback that I advised to stop it abruptly. No, she didn't. She wrote that I spoke or I lectured about alcohol. So she mind that I lecture the patient about his alcohol. I don't know.
Oh.
Is it wrong to advise about stopping alcohol in an HCV patient? I don't know.
Oh. But
So
I think this is the right approach, doctor, because alcoholic patient, what is the here priorities? Number one is trying to stop the alcohol, trying to take the patient into the confidence to stop the alcohol. Number one. Number two is try
really,
to.
this scenario till now I cannot understand what they want
Okay.
about this scenario. What they want from the candidate. Alhamdulillah, I got
Oh.
good marks in other stations. That's why
Uh-huh.
it helped me to pass. But in this station, they give me 10 out of 16, and I don't know why they minus me, and I don't know what they need from me. When I received the feedback, I was wondering. They wrote that I lectured, and
Uh-huh.
they wrote that I didn't talk about the medication. Although I remember,
Oh.
pretty sure I remembering that I mentioned to him, he was
Uh-huh.
also hesitant to start the medication, but I told him
Uh-huh.
you have
Uh-huh.
to take the medication because it's carrying a lot of benefit. And he told me, no,
Yeah.
doctor, I heard about the side effect. I told him there
Uh-huh.
is always side effect for any medication, and
Yeah.
always we are outweighing the risk versus the benefit.
Yeah.
But
Yeah.
always add the benefit more than the risk. So we have to start this medicine. They wrote that I didn't talk about the plan and the starting the medication. I don't know
Oh.
if they were with me or they are in another world. I don't know. But it was a very horrible comment about lecturing about alcohol, which is I don't know if
Harsh,
someone
doctor,
will.
very harsh.
Yeah, I don't know if someone will face this scenario. How to deal with? Is
Yeah.
it just talking about the HCV, which is uh, okay? What I will tell about HCV.
It
By the
includes
way,
anything.
I wrote also I sorry I said that it might lead to cirrhosis, which is scarring of
Yes.
your liver, just to make
Yeah.
it serious.
Yes.
The other examiner, which was Egyptian, he wrote
Uh-huh.
that I was fearful to the patient.
Really?
Yes, cancer.
But that's what we do, no, doctor, because
I don't know.
we
Really, this scenario is the worst scenario in communication I saw in my Pace's life. So
because
I
doctor,
don't know what they want to.
n- normally what we do is we'll try to tell the patient, like the little bit complicated side effect, so it's complicated, conditions if you not take the medicine, so that
I am
patient
not
will be.
honest. I didn't mention the cancer and cirrhosis. I'm not honest with the patient because he may not
Yeah.
take some medication.
And this is how we try to convince the patient. Okay, we'll tell the side effects more in a more highlighted way, so that the patient will be ready to start the medication. That's how we do, na doctor.
Exactly. This is what we are also doing, practicing every day.
Yeah. Yeah.
But I don't know. This one, the lady, because she was British, she talked about the alcohol. I don't know. Maybe she doesn't want me to talk about alcohol, and she wants to leave the patient drinking alcohol, and this is against the whole medicine. Maybe because she allowed the alcohol there in UK, she doesn't
But
want me to talk about alcohol. I don't know. The other examiner, I spoke about the possible side of the possible complication of this virus, and he said, or he commented that he was fearful to the patient. I don't know how to deal with this scenario really.
I
I
don't know, doctor. No idea. You
Yeah,
are,
that's why we are trying to figure out this scenario, because till now it's not clear for Dr. Aisha. You have a comment from the examiner about this scenario?
No, but I heard it many times. It is like that, done
Someone
to
said cancer.
discover the alcohol, and yes, and making side effect all of HCV, to be honest with the patient.
The patient is
the
reluctant even to start the treatment, so that you need to open his eye wide.
I
Yeah, but
appreciate that he was IV drug abuse, and I said, yeah, you did a great job when you stop it. Now the time to stop the alcohol. And he said to me, "Oh, doctor, you want me to stop everything? So you want to keep drinking alcohol and you want to damage your liver? I don't know how to solve this problem with the examiner."
هي دكتور باسم
Uh-huh.
في زي سيناريو زي كده برضه قبل كده انه تقريبا يعني انت
He is
just
drinking with limit, this patient of your Dr. Bassem?
no.
I didn't
But
ask about amount, because
You
any
didn't
amount
ask
here
him.
is prohibited,
Yeah.
right?
no need to take history.
Yeah.
Even
Yes,
if
CB
I should
prohibited,
ask, even I should ask, if I should ask, if I found he is taking 10 or 1 or 3, so it's allowed to continue drinking alcohol and the patient already is HCV.
Yes, CB. Yeah, not allowed. No.
Yeah, it's harmful.
Is a developed liver cirrhosis not allowed?
We will wait till develop.
No. Anyhow, he has a risk of developing liver cirrhosis, right?
Yes.
I trying
طيب
to
هنا
search on the
مثلا
site.
سمعت كومنت فيدباك قبل كده بيقول لك انه don't say to the patient you need to stop this, or you need يعني just like this is the ordering the patient. Right? Yes, you will justify the whole condition. This is will risk your health, this will risk your life. So I'm highly advising you to quit alcohol. And I can, regarding this, I can refer you to alcohol cessation clinic, something like this. الكلام يكون شوية smooth, لكن just like يعني to say to the patient that you need to stop this, بيعتبروها كأنك كده this is an ordering the patient.
So you think in the
In,
language is the problem? No, you shouldn't. We need to tell in a way like
you
it's
will
a bit
encourage, but you can
No, you
order.
can't order it.
just because it reduces the effective of antiretroviral and
أنا بعرف واحد قبل كده
accelerate
قالوا
the damage
feedback.
of the liver. But they said yes, he can drink within limit.
He can drink.
feedback هتقول
Yes,
له إنه
but you should
order
advise as much as you can to cut out the alcohol, that it will accelerate the damage of your liver and it will interfere with the medication of antiretroviral. But he can drink.
This doctor, for this patient, he is willing to stop alcohol already. He feel guilty and he want to
Yes,
stop.
and this is
Yes, we can.
drunkard. We talking another point here. He drinking. He is alcoholic, so he should advise about alcoholism, even if he does not HCV.
Yeah.
Yes, I see.
In British
That
Liver
we can
Trust.
tell him.
Okay,
Okay,
continue,
continue.
doctor.
Okay, we can offer him to start with alcohol cessation clinic. Simultaneously, we will start for him HCV treatment in the same time in the hospital.
Dr. Ali, I offer him this service, and I offer him community group or so, they are already having the same problem, and he can share the idea with them. I did everything about the possibility how to solve and how to cut down the alcohol with good way, because he's drug abuse, so he need a lot of support, and
Mm,
he's jobless. I told him
mm,
it's okay, no worry, we will have a support for you.
mhm.
And family also, he said I am alone. I told him it's okay, we have it's okay, we can support you also socially with these groups, so you'll not feel alone. But again, I don't understand the point of talking about alcohol,
Yeah,
and why the minus this marks. It's already for me done, but for the others, the scenarios are repeated. But how to solve this scenario? Is it examiner wish? So this examiner accepts this behavior, and the other one will talk
It
about.
is a British Liver Trust, hepatitis C. If you're recovering, you should only drink a very small amount of alcohol, aiming to 2, 3 consecutive alcohol-free days every week. So 2 to 3 free days, and two minimum, small amount, but they will not stop completely. If he is chronic,
uh,
not active right now, recovering,
Mhm.
difficult, doctor.
it is
NHS.
British Liver Trust. Yes, UK.
Maybe that is the thing. Okay. Anyway, protocol. Maybe that is the guideline.
So, but here, if alcoholic, we should advise. And I think you can advise to quiet, because they write like that. You
Mhm.
should advise to cut off completely. But
Yeah.
if he
He
resist,
insist on drinking, then
yes,
maybe yes, cut
you
down
should
is the
minimize
option.
and making 2 to 3 days every week free.
Could
So
be,
this
yeah.
is regarding the British examiner. The Egyptian one, opposite. He didn't talk
Opposite.
about alcohol. Yes, because he's Muslim,
He
of
said you
course.
make the patient scared about the
Yeah, but
hepatitis
he
C.
comment about the other thing. So they are not agree with the same comment.
Oh,
So
okay.
yes, yeah, we don't know if this scenario will come. So how the protocol to answer or to address this scenario? Negotiate. I think this is one of the most difficult scenarios in basis. Why? Because every examiner has his wish, no protocol. But for the
Mm-hmm.
medical error, every examiner will have
Same
the
protocol.
fixed protocol, yes, the
Mm.
end of life, the palliative. But for the
Yes.
negotiation for something you don't know what they want from you, it would be a difficult scenario. That's why I think this is a very difficult scenario. I didn't hear any mentor talking about this scenario.
But
But
any
if
medication, Dr. Bassem, to
it's
encourage the
not,
patient on, you should mention the
Tomorrow,
complication of the disease, even the most serious complication.
this is what I did. I did
Mhm.
like
tomorrow
that.
I'll talk with one mentor doctor, and I'll try to get back,
Yeah,
doctor.
if you can or anyone has, but I don't think also the mentor will know, because the
Yeah,
mentor is just receiving the feedback. So it's examiner wish again. It's examiner wish what he want to
Opinion.
hear.
yeah.
Really, yeah, what he want to hear. If you didn't
Even
mention,
something, it is not logic in feedback, Dr. Bassem. They someone write for me that you didn't making the expansion technique so good. And
oh my
this
god,
first time someone tell me like that. And
expansion
he
technique.
expansion of the chest.
Yes, I know, I
How
know.
it is not and it is not very difficult things to be bad technique or anything.
Yeah, yeah,
And even he was in front and I making
in
at
the back.
back.
Yeah,
So
how
I
you know
don't know
I do. Yeah.
how, but they having a comment in that like that. Yes.
Expansion what, doctor?
She
Expansion
did
technique. I don't
technique.
know if it is has
There is
specific
technique
technique.
for the expansion.
Yes,
Anyway,
this is a comment for me. They deduct 2 marks. And about the pyloric phase, the finding, they deduct also 1 mark. That I didn't catch the pyloric phase. This is
Oh,
so it's examiner wise. If you have chest
Yes,
case and you
yes,
have all the finding and miss
you're
the
right.
plethoric phase, it's not
Exactly. Yes,
logic to deduct
it's
the
not major.
plethoric
Yeah,
phase.
it's not
It's
major or
not
fatal
major
mistake.
things, yes. And the patient have a lot of finding. I mentioned also. You have it is examiner wise. He
Yes, you're
have
right.
a
Yes,
specific mind, and
yes,
even the
you're
other
right.
one he didn't deduct. So if you have one deduct, so it's his opinion already.
yeah, yeah. This has happened with me also, doctor. In my previous cardiac case, doctor. Like they gave me 19, and one doctor they gave me borderline pedal edema, mild pedal edema. For mild pedal edema, one of the examiner got 1 mark for me.
Mhm.
It's okay for
Yes,
one market, doctor. Yes, but at
but
least,
it was
yeah,
fine for me.
Alhamdulillah, if you pass, you will forget everything. But I this scenario really it's difficult scenario, and I want to make it as a teaching point of view,
I
clear,
think Dr.
clear
Sam
for
can
other.
will do it tomorrow. I don't know. Maybe. No, no, no. This is not the scenario. It's the TB scenario.
Mm,
You
it's
can
good for me.
suggest to him to have a look
Yes, we
this
can
scenario.
making a suggestion. Yes, for
Yeah.
Dr. Ahmad or Dr. Hassan. But even والله Dr. Bassem,
We
Yes,
don't know.
you're right. Even, yes, you're right. Even, you're
all
right.
one everyone have
Yes,
special
yes,
consideration. He
exact.
have opinion.
Yes,
Yes.
Yeah,
agree, 100%. Even Dr. Ahmad, when he did the paracetamol toxicity scenario, and he did, if he said, if you do like this, they will fail you. If you do the other, they will success. You will pass and they give you success. But still, in the exam, no guarantee that you will get the mark as Dr.
yes.
Ahmad judge, because Dr. Ahmad little kind guy,
Mm-hmm.
but the other
Mm-hmm.
Mhm.
examiner they are not kind examiner. So I don't think he will judge as Dr. Ahmad judgment.
Yeah, Dr. Imad is more generous. Yes,
Exactly. Yes, he's too
more
much
generous.
decent and yes, polite one, and he can
Yeah,
give marks easily without any argument with the candidate. But
yeah,
others, I don't think they are behaving like Dr. Ahmed. So that's why you cannot take the judgment of Dr. Ahmed as a rule. Maybe Dr. Ahmed
yes.
will give you good marks and
Mm.
good judgment, but other examiners, they will be toxic in the same scenario, in the same uh, even case.
Yeah, yeah. You're right, doctor. Especially
Mhm.
the
Yeah.
Indian examiners are very, I mean, very toxic.
Okay, hopefully, inshallah, this scenario will not come to anyone, but anyone has any background about this scenario, please share it with us just to correct others, because we don't know what will happen for you in the future. Anyone might face this scenario.
Mhm.
But for the other scenarios, I believe it would be very easy. The palliative, the end of life care, the breaking bad news,
Yeah.
counsel about disease,
Mm.
apart from negotiation. So, counsel about disease, which is known disease, but to
Mm.
negotiate about starting and he's diagnosed HCV, this scenario is really very tough scenario.
Yeah, yeah.
Okay, any
All
comment?
right.
Thank you, Dr. Yasser, for
Thank you.
volunteering
دكتور
today.
باسم
And yes, yes.
معلش بس اخر حاجه في البوست كيسز اللي هي الاتش اي في والاتش سي في
Mm-hmm.
في داعي ان احنا مفترض نعمل سيفتي نتنج انه هو سيف براكتس سيف الحاجات دي
Yes, you're right.
صح؟
Thank you. Thank you, Dr.
تمام.
Muhammad, yes.
اوكي.
Of course,
Yes,
it's
I should
one of the
remind him
important.
about. Yes, yes.
Yes. Once,
both of
by
them.
by the way, Dr. Yasser, I
Yes, doctor.
prefer to break bad news once
Oh, that
rather,
one. Oh, okay, okay. That
rather than
TB and
making them
HIV.
yeah in pieces. Why
Uh-huh.
it would be one shocking news? You have TB and HIV in the
Yes.
same time. I'm sorry, I don't have good news for you today. What you mean,
Uh-huh.
doctor? What you mean by this?
Uh-huh.
Sadly, the result is that you have a condition called tuberculosis, and the result also showed that you have HIV. Then give him 3 seconds or 4 seconds because you give him two disease now, HIV and
Uh-huh.
TB. Then
Uh-huh.
explain the HIV and TB once also. So
Uh-huh.
the scenario, all scenario will be like shortened and concise to talk about counseling once the TB and the
Uh-huh.
HIV. Yes, both of them are different, but still
Uh-huh.
the management plan, the contact tracing will be the
Yeah.
same. So you will have time to give him safety netting. Thank you, Dr. Muhammad, for reminding. Supposed to mention this in the comment area, but you have to give him this. And also for the TB,
He
if
already
the,
asked me about safety netting.
I really, Dr. Yasser asked
But for
to
me,
have
I forgot. But because my scenario also have safety, he should also practice safe sex and avoid needle
HCV.
sharing. Yes.
It's not it's necessary as the HIV itself.
No, all
Because
virology. B
hepatitis
and
C,
C.
hepatitis C is not by sexual, I think. It's hepatitis B, the one with sexual
I
No,
don't
Dr.
know.
Both.
transmission.
No,
But
Hepatitis C.
we usually advise in all virology, avoid
Mm.
needle sharing, avoid
Yeah, everything, doctor. 30%,
making
3%,
safe
and
sex
0.3%.
and the blood transfusion.
Yes, sharing needles. Yes, you're right. But the second scenario is not giving time like the first scenario, because the first scenario is clear that you have the HIV as a new result. I don't know the second scenario, just to counsel, negotiate. You don't have time to give him, but if you have time, yes, you have to do safety netting at the end. Anyway, thank you for this point. It's important. Always remember them. Again, as a review also. The HIV is not notifiable disease, but the TB is the one. So if you have scenario with TB, you have to mention that you notify the disease to the infection control team. But the opposite side, the HIV, no need to say this is notifiable disease, but we will contact tracing both of them, the HIV
Yeah.
and TB. Yes.
Yeah.
Okay.
Good. Thank you, doctor.
Thank you, Doctor. Doctor Yes, really, I was about to cancel this session, but really, after you volunteer, I being
problem.
motivated as well for Dr. Aisha, because she didn't practice since long time. So you survived this session. Thank you, both of you.
No.
Thank you for your
Thank you. From now onwards, for 1 month, I'll be regular doctor.
It's okay, Dr. Yasser. Just forget about it. As I said to you, enjoy the time and don't think about what happened. Just think for the current and the future.
Yeah, doctor. Thank you, doctor. Really
Okay.
appreciate your kind words, doctor.
Thank you, Dr. Yas. Any other comment or question from others? Okay, it seems satisfied. Thank you all. Thank you, Dr. Aisha, Dr. Yasser, particularly, Dr. Ali, and others. See you tomorrow, inshallah, with the clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you.
Thank you.
Good night. Good night.
Thank you.